So we were discussing depression, and we were discussing some examples of depression. So now a summary of some points on the treatment of depression that we have already discussed. If there's a myocardial infarction or history of myocardial infarction, sertraline is the first line antidepressant and citalopram is the second line. If patient is on warfarin, remember that a patient on warfarin or SSRI are contraindicated in patients who are on warfarin. So in that case, the drug of choice will be mirtazapine. Another indication for the use of mirtazapine is that if SSRI do not work with a patient, we can use atypical antidepressants such as mirtazapine. And tricyclic antidepressant or amitriptyline is the drug of choice in psychotic depression. It should be continued for 6 to 9 months after resolution of the symptoms. So remember these points, these are very important. Someone with a history of myocardial infarction, the drug of choice is sertraline, first line. Second line is citalopram. Someone who is on warfarin, SSRI are contraindicated and we will use mirtazapine. And if depression does not respond to SSRI, again we can use mirtazapine. And if someone has psychotic depression, then amitriptyline or tricyclic antidepressants are the drug of choice, not SSRIs. So in psychotic depression, tricyclic antidepressants such as amitriptyline is the drug of choice, and we need to continue the medication for 6 to 9 months after the resolution of symptoms. It cannot be discontinued less than that, even if there is improvement in the symptoms. For example, a woman who become depressed after her husband's death of cancer, she was using amitriptyline, her appetite had improved, she used the antidepressant for 3 weeks and wanted to stop. She also felt she now had the cancer her husband had and was calling the GP daily for him to do something. So a female who is using amitriptyline for 3 weeks, her symptoms has improved. So what should we do? In this case, we should advise or encourage her to continue amitriptyline. So in this case, we'll advise the patient to continue with amitriptyline.
Can you please repeat those indications for mirtazapine and sertraline?
Indication for mirtazapine?
All of these, sertraline, mirtazapine.
Yes. Someone with a history of MI, drug of choice will be sertraline. If sertraline is not given in the option, then citalopram. A female who is breastfeeding, sertraline is the drug of choice. A patient who is on warfarin, mirtazapine is the drug of choice. A patient who does not respond to SSRI, mirtazapine is the drug of choice. A patient with psychotic depression, tricyclic antidepressant or amitriptyline is the drug of choice. And they should be continued for at least 6 to 9 months after the resolution of the symptoms. And the drug of choice in children and in adults who are less than 18 years old is fluoxetine.
Yes. Thank you.
Remember that the risk of suicide may actually be increased in the early stages of antidepressant treatment. So if someone is started on antidepressants, In the exam, sometimes they ask a question that a person or is started on antidepressant. So what is the most important uh, risk factor that can increase the risk of suicide? And in the options will be given to you: alcohol use or antidepressant use. So in that case, you will select the use of antidepressants, because the risk of suicide may actually be increased in the early stages of antidepressant treatment. So this is an important point to remember, the high yield point. So this was all about depression, atypical depression, psychotic depression, and the drugs that can be used in different scenarios. Now our next topic is postpartum mental health problems, such as postpartum blues or baby blues, postpartum depression or postnatal depression, and puerperal psychosis or postpartum psychosis. So what is baby blues or postpartum blue? Remember that the one word for baby blues or postpartum blue is crying, that mothers are mostly crying after the birth of the baby. If the main presenting complaint of the mother is crying all the time, then your diagnosis will be postpartum blue or baby blues. Postpartum blue or baby blues, they typically are seen 3 to 7 days following a birth. So this duration is also very important, because postnatal depression, it usually peaks at third or fourth week postpartum. But postpartum blue, it occurs in the initial days and typically seen 3 to 7 days following birth. Mothers usually care for their baby, and mothers are anxious, tearful, and irritable, and they are mostly crying. So two important points uh, that are highlighted red that you need to remember for postpartum blue or baby blue, that is, it occurs 3 to 7 days following birth, and the mothers are mostly crying. Now, postnatal depression. Postnatal depression peaks at 3 or 4 week postpartum, but can occur any time in the first 6 months. But usually it peaks at third or fourth week postpartum. Features are similar to depression seen in other circumstances. That is low mood, low interest in activities, insomnia, etc., loss of weight, loss of appetite. So the symptoms of postnatal depression is like the symptoms of depression in general. The mothers usually care for the baby, but with occasional thought of harming the baby. Occasional thought of harming the baby can be present in postnatal depression as well. So don't get distracted by this occasional thoughts of harming the baby, because harming the baby is basically a feature of postpartum psychosis or puerperal psychosis. But it can be present in postnatal depression as well, but they are occasional. Important example of postnatal depression is they include the mother feels that she cannot look after her baby, and that she won't be a good mother, and she is tearful and anxiety. So you can see that postnatal depression can also have a feature of crying or tearfulness, and it is a feature of postpartum blues as well. But in postnatal depression, other signs of depression will be present as well, and she will feel that she cannot look after her baby, and she won't be a good mother, and she worries about baby's health most of the time, and worries about her ability to cope with her newborn. So these are some important examples which will help you in diagnosing postnatal depression. Now, puerperal psychosis or postpartum psychosis, as its name indicates, there will be psychotic symptoms such as delusion, hallucinations. For example, thoughts of harming the baby, hearing voices saying baby is evil or has evil eyes, delusion that the baby is deformed or evil, insomnia and disorientation, thoughts of suicide. So suicidal thoughts, delusions that her baby is deformed or evil, and auditory hallucinations or voices saying her baby is evil or has evil eyes. So in a postpartum period, if a woman presents to you with psychotic symptoms such as delusions and hallucinations, then your diagnosis will be puerperal psychosis. So it's a straightforward diagnosis. A woman in the postpartum period present to you with psychotic features, your diagnosis will be puerperal psychosis. Now, what are the treatment options in case of baby blues or postpartum blue? Reassurance and explanation to the patient that this is normal during this period and it will resolve on its own with time. It does not require usually treatment because it's a self-limiting condition and the symptoms usually subsides within a week. The treatment of postnatal depression is like depression in general, that is CBT and SSRI. And if she is breastfeeding, then the antidepressant of choice would be, if a female is breastfeeding, what would be the antidepressant of choice for management of depression? Anyone?
Sertraline.
Which one?
Sertraline.
Yes, sertraline.
Yeah.
So sertraline is the drug of choice in MI and in breastfeeding as well. So one way to differentiate between baby blues and postnatal depression is to look at the duration. Postpartum blues, they occur in the starting days, and postnatal depression, it peaks around 3 to 4 weeks, and it can last for months. While on the other hand, postpartum blues, it only lasts for a week. And to differentiate between postpartum psychosis and postnatal depression, you will look for hallucinations or delusions. If hallucination and delusions are present, then it is postpartum psychosis. And the treatment for postpartum psychosis is admission to the hospital with a specialist mother and baby unit and electroconvulsive therapy. Mood stabilizer or antidepressants can also be used, but the definitive management is usually electroconvulsive therapy. Now let's discuss some examples of different postpartum conditions. A woman has delivered a baby 6 weeks ago. She feels sad and has no interest to feed her baby. So she has no interest to feed her baby. In postpartum blues and in postnatal depression, we saw that the mother usually care for her baby. And in postpartum psychosis, the mother does not care for her baby. So in the first line, we can assume that the diagnosis is postpartum psychosis. She eats poorly and has poor sleeps. She says that the baby has evil eyes. So delusions are there and the mother does not care for the baby. So the diagnosis is postpartum psychosis. You can see that a few features of depression is also given. That is low appetite and low sleep or insomnia. But She does not care for the baby and she has delusions. So this is postpartum psychosis. Another example, a woman has delivered a baby 3 days ago. She thinks that the midwife wants to harm her baby. Now again, a delusion is present. She sometimes hears voices. Hallucinations are also present. So delusion and hallucination are the hallmark of postpartum psychosis. Another example, a 34-year-old woman has delivered a baby 3 days ago. She has anxiety, irritability, and poor sleeping. So poor sleeping is a feature of depression as well. But she is crying all the time. And she delivered the baby 3 days ago. So if anxiety and tearfulness and if these symptoms occur in the first week, then it is most likely baby blues or postpartum blues. And if they occur in the third or fourth week or after the first week, then it is postnatal depression. For example, let's as see this example. A 30-year-old woman who gave birth 6 months ago present to her GP complaining that she is crying all the time. So we discussed that crying is a feature of both postpartum blues and postnatal depression. Then how we are going to differentiate between blues and depression is depending upon their duration. Postpartum depression or postnatal depression, it peaks around 3 to 4 weeks and can persist for months. So in this scenario, you can see that the woman gave birth to a baby 6 months ago. So it cannot be blues because blues are present only in the first week in the postpartum period. She is crying all the time, not bonding with her baby, worried about baby's health constantly, being unsure if she can cope with this new change in her life. So one hint towards postnatal depression is the duration of the symptoms, and the other hints are that she is worried about baby's health, and she is not sure that if she will be able to take care of her baby or not. So the likely diagnosis is postnatal depression, and the treatment is CBT and then SSRI. So this was all about depression in postpartum period and its management.